Hello students at Pima Medical Institute. My name is Jeanette Jones and I am one of the Academic Operations Managers here at PMI. On behalf of our corporate directors, education department, faculty, and staff, I want to communicate how excited we are to welcome you back to campus in a full-time capacity. As a representative of PMI, a provider of medical career education, and as a nurse myself, it is important for you to know that your safety is our priority. In this presentation, I will be summarizing the key ways that PMI wants to partner with each of you to promote the health and wellness of students, faculty, and staff while on our campuses and in our classrooms. We will briefly review what we have learned about the coronavirus, specifically COVID-19, and the key ways that we can protect the health of ourselves and others, which include hand hygiene, personal protective equipment, PPE, and vaccinations. As future healthcare providers, we believe this focus on health promotion and wellness is key to not only prepare you for a safe return to our campuses, but to prepare you for your clinical experiences now and after graduation. COVID-19, what we know. Here I will be sharing some key information about COVID-19. Coronaviruses consist of a group of a variety of viruses. The name of the specific virus involved with COVID-19 is Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The name of the disease it causes is Coronavirus Disease 2019, which we have come to know as COVID-19. The mode of disease of transmission for COVID-19, which is the method in which the infectious agent reaches a susceptible person, is through close exposure with a person infected with COVID-19. This occurs mainly through respiratory droplets caused by coughing or sneezing. There are many ways to effectively protect yourself from COVID-19, several of which we will be reviewing in this presentation. These include hand hygiene, respiratory etiquette such as coughing into sleeve or elbow, use of mask, personal protective equipment, PPE, and vaccination. It is also important to note that these measures, specifically hand hygiene and respiratory etiquette, can also keep you healthy from other illnesses such as the cold and the flu. Hand hygiene. Hand hygiene is one of the most effective ways to protect yourself from getting sick and to stop the spread of a variety of bacteria, viruses, and other organisms, i.e. germs. Proper hand hygiene is an important part of preventing the spread of germs, in particular respiratory infections from one person to the next. Soap and water is the most effective method for removing germ particles, such as bacteria. This is also the method that should be used if hands are visibly soiled. Remember that you want to wash your hands with soap and water for at least 20 seconds. Hand sanitizer should be looked at as an alternative method for hand hygiene if soap and water is not readily available. When using hand sanitizer, select a solution that is at least 60% alcohol and allow it to dry for about 20 seconds after application. Use of masks and PPE. Pima Medical Institute will be following the Centers of Disease Control (CDC) guidelines regarding the use of masks. Individuals who are fully vaccinated do not have to wear a mask. Those individuals who are not vaccinated are required to continue wearing a mask indoors, as well as observing social distancing when possible. If individuals who are fully vaccinated would prefer to continue to wear a mask, then they are encouraged to do so. Also, immunocompromised individuals may also want to consider continuing to wear a mask. While these are the guidelines that will be utilized on PMI campuses, it is important to keep in mind that the CDC is still recommending the use of masks for employees, patients, and visitors, regardless of vaccination status, in hospitals and other healthcare settings. Students, even those fully vaccinated, should be prepared to wear a mask at clinical, externship, and/or fieldwork sites, if so required by the facility. The CDC has issued additional guidance to healthcare professionals regarding the various types of masks and the protection they offer. The CDC refers to well-fitting cloth masks, face masks, or respirators as source control for COVID-19. These various types of source control should cover a person's mouth and nose to limit the spread of respiratory secretions caused by talking, coughing, and sneezing. Per CDC, face shields alone are not recommended for source control. A cloth mask is a textile cloth covering that is intended for primary use in the community. This type of source control is not seen as personal protective equipment, PPE, for healthcare professionals due to the varying degree of protection these offer the wearer. A face mask is a type of PPE recommended for use by healthcare personnel and are often known as surgical or procedure masks. A respirator is a PPE device that covers the nose and mouth and protects the wearer against airborne particles. A commonly known type of respirator is a filtering face piece respirator, FFR, also known as an N95. While on PMI campuses, unvaccinated individuals are encouraged to wear at minimum a properly fitting cloth mask. Again, students may be required to wear another level of source control per externship, clinical, and/or fieldwork facility guidelines. Individuals may also choose another level of source control based on the degree of protection offered. Vaccination. In this section, I would briefly like to define immunity, address the most recent evidence and guidance on COVID-19 vaccines per the CDC, and provide the guidelines that PMI will be following regarding vaccinated and unvaccinated individuals. COVID-19 vaccines, what we know. Before summarizing some key information regarding the COVID-19 vaccines, I want to provide a basic definition for immunity. Immunity can simply be defined as protection from an infectious disease. Immunity enables a person to be exposed to a disease without becoming infected. Immunity can be described as being active or passive and as being natural or vaccine-induced. Active immunity results when exposure to a diseased organism triggers the immune system to produce antibodies to that disease. Passive immunity is provided when a person is given antibodies to a disease rather than producing them through their own immune system. For example, a newborn baby acquires passive immunity from its mother through the placenta. Exposure to the diseased organism can occur through infection with the actual disease, resulting in natural immunity, or introduction of a killed or weakened form of the diseased organism through vaccination, vaccine-induced immunity. Either way, if an immune person comes into contact with that disease in the future, their immune system will recognize it and immediately produce the antibodies needed to fight it. Getting the COVID-19 vaccine is one step to protect against the virus. This step can help establish herd immunity. Herd immunity, sometimes known as community immunity, is achieved when a sufficient amount of people within a population are immune to a specific disease or illness. This can be achieved either by previous illness or vaccination. This level of immunity in the population makes it less likely for the illness to continue spreading from person to person. The illness isn't able to spread easily and thus provides some protection even to those that can't get vaccinated, i.e. newborn babies. The concept of herd immunity relative to the virus that causes COVID-19, SARS-CoV-2, is largely dependent on if having the infection protects someone from the coronavirus long term. Scientists are still not certain on this point. There have been various estimates on how much of the population would need to be infected to achieve herd immunity. Most scientists believe that the percentage needed to achieve herd immunity is safest to achieve only with the use of a vaccine. Current research on the 3 approved COVID-19 vaccines in the U.S. shows that they are effective in protecting against COVID-19, including severe complications that can occur from COVID-19. The most recent research also shows that the vaccines are effective in real-world conditions, as compared to the effectiveness they have shown in clinical trials. While each of the 3 available vaccines have shown effectiveness, there is more data related to the mRNA vaccines due to them being available longer. Since it typically takes about 2 weeks for a person's body to build up protection after a vaccine, the CDC defines an individual as fully vaccinated 2 weeks after the last dose of a vaccine. While it is still possible to get sick with COVID-19 after being vaccinated, it is likely that symptoms would be less severe. The CDC currently recommends for individuals who are eligible to get vaccinated with all the recommended doses of the COVID-19 vaccine. At PMI, a fully vaccinated individual will not need to mask or socially distance. If an exposure is expected, fully vaccinated individuals will not need to quarantine unless they are symptomatic or test positive for COVID-19. Individuals who are not able to provide proof of vaccination or a negative PCR test post-exposure will need to quarantine for 14 days if they were within 6 feet for 15 minutes or more of an individual who has tested positive. As educational providers for the future healthcare workforce, Pew Medical Institute takes your safety and well-being as our top priority. While the future related to COVID-19 remains unknown, we believe in remaining vigilant and following the infection control measures shown to be effective. As future healthcare workers, it will be your responsibility and privilege to provide education, skill, and compassion to individuals as we continue to provide care to various populations amid the pandemic. Pima Medical Institute will continue to partner with you to provide safe environment based on CDC, state, and local guidelines. Thank you for listening to this presentation. On behalf of Pima Medical Institute, stay safe and well, and welcome back.